Hello, dear students and esteemed learners. Welcome again. Now we have lecture 17, and we are basically on the fourth week of our course on sociology of health. So, in the fourth week, we are trying to understand the concepts related to medicalization and demedicalization. And in the previous lecture, we talked about medicalization, tried to understand the various meanings given by different people and the contexts. Now, in this lecture 17, we will talk about demedicalization and then medicalization and emerging discourses. So, demedicalization is another important process which we talk about along with medicalization, and then simultaneously there are other emerging discourses related to medicalization, and we'll talk about those discourses also. So, the concepts that I have covered in this lecture are understanding demedicalization, then the emerging discourses within medicalization, then under medicalization and over medicalization, and then one very important and interesting process that is generally identified as pharmaceuticalization, right? So pharmaceuticalization is also an important discourse which is emerging in contemporary literature, and we will talk about all these in this lecture. So let us move to the first slide, and here I have tried to define demedicalization. Now, we have understood medicalization in the previous lecture, where we stated that when medical terminology or medical institution or medical approach is applied to a problem which was earlier not considered as a medical problem, then this process is known as medicalization. However, we talked about several interpretations of this process. If you have not watched that lecture, then watch that first, because this lecture will be a kind of continuation of the kind of understanding that we had in the previous lecture. But we will talk about other concepts also here. Medicalization is bidirectional. Bidirectional in the sense that there can be two different directions. One is the direction of medicalization, and second is the direction of demedicalization. That means when certain situations, behaviors, or problems are identified as medical, then this is known as medicalization. And if we try to reverse that, that means when certain situations which are already identified as medical, but because of certain reasons, if those are coming out of those medical nomenclature or medical jurisdiction, and then they are becoming non-medical, then this will be considered as the process of demedicalization. So, hope you understand the word demedicalization, right? Demedicalization is the political and ideological process by which the medical profession loses influence over various aspects of society. Because medicalization was a process by which the medical profession was enhancing its influence. So it's a reverse of that. That means in this demedicalization, the medical profession will lose some of its influence over certain aspects of the society. Now, what is very important here is this, that there is mention of the words political and ideological, because this demedicalization is happening in situations or circumstances which could be identified as political or ideological. Otherwise, it will be difficult for the process of demedicalization to happen. So, while defining this, we are making use of these two important contexts, and that will get reflected in this lecture as we will proceed. Alternatively, the political and ideological process by which the medical profession, as an agent of social control, loses influence over which social problems and behaviors are defined as sickness as opposed to badness. So, while talking about medicalization, we talked about from badness to sickness. Now, there is a reverse process of from sickness to badness or maybe certain other situations. It is not necessarily from sickness to badness, but it is from sickness to a new situation which may not be considered as sickness kind of thing. However, the political and ideological context is also applied in this particular statement. For demedicalization to occur, the problem must no longer be defined in medical terms. That means that is the specific definition, that if the medical terms were used, then those particular situations became medicalized. And if that medical nomenclature or medical context is removed, then that will be considered as demedicalization. And medical treatment can no longer be deemed appropriate intervention. So, when this medical context is removed, that means that particular situation is no more in need of a medical intervention, right? I hope you got an idea about this process. One most frequently mentioned example is related to the practice of homosexuality. Now, homosexuality in America until 1973 was defined by the American Psychiatric Association as an illness or a mental illness. That means American Psychiatric Association was defining homosexuality as an illness that was basically medicalized. After protest by the gay liberation movement and support from some sympathetic psychiatrists, the APA voted to declassify it as an illness, a decision that was later endorsed in the United Kingdom also. That means there is declassification as an illness. That means this particular phenomenon was no more considered as illness. So, this withdrawal of the nomenclature or the status of illness from the practice of homosexuality could be identified as demedicalization. And as a result, homosexuality became more widely recognized as a lifestyle choice. So, from a sickness condition, it became a lifestyle related situation. Just like that, there can be several other situations where some sort of demedicalization is taking place. We will talk about some of those situations in the other context as we will proceed further in this lecture. However, the authors have also mentioned one specific situation related to this particular phenomenon of homosexuality, and they are saying that with the arrival of AIDS, there was some kind of reconsideration related to this particular problem of AIDS, and in this changed situation, homosexuality was considered to be a kind of factor which can promote or enhance the possibility or susceptibility related to AIDS. So that way, it again came within the medical domain, and this is identified as remedicalized or remedicalization. So we can understand that when certain situations are not identified as medical, may be identified as social or personal or psychological, and from this domain these are getting identified as a medical, then this process will be called the process of medicalization. Now, because of certain other developments. And what are those other developments? The ideological or the political situations. So, because of certain other political or ideological situations, maybe in a different context, some of the problems which are identified as medical problem, if those are declassified from medical to non-medical, then this will be the process of demedicalization. And if there is a situation in which again this is identified as a medical, then this will be the process of remedicalization. I hope you can understand these processes by now. Overall, the evidence to date is that medicalization is far more common than demedicalization. That means at a larger level, we are witnessing the process of medicalization, and the situations related to demedicalization are rare, fewer. Now, we will try to understand some of the emerging discourses related to medicalization also. We can also talk about alternative discourses, but this is basically an emerging kind of understanding. Not enough work has been done, and there is a scope of basically application of these situations to understand this type of behavior in the larger context. So we are talking about that. Now, Irving Zola talked about basically the process of medicalization in terms of four specific situations. Now we will talk about those situations, and we will further try to see if those situations are related to the other emerging discourses within the process of medicalization, or can we apply these conditions to understand some of the other emerging discourses, right? So first we will see which important situations Zola is talking about. Now Zola is basically talking about the process of medicalization in terms of four conditions, like expansion into more and more areas of life. We have already talked about it. Then absolute control over techniques. Now there are certain techniques, medical techniques, and techniques are basically emerging, keep on emerging. So when medical profession is having absolute control over those techniques, then this is again enhancing the pace of medicalization. Then access to intimate areas of life. Now in human life there are so many types of situations. Some of those situations are related to the private or personal things like sexuality or other such related things. Now medical institutions are finding increasing access to those intimate areas of life, and that is also basically a process of medicalization. And finally, the fourth point is medical involvement in ethical issues. That means certain situations which are basically identified as ethical issues, those are also getting medicalized. So these are the four specific situations that Zola is talking about. Now we can use this categorization for understanding other emerging discourses related to medicalization. And two important discourses that we can talk about are over medicalization and under medicalization. Because when we talk about medicalization, then we get to know that there is some kind of differences in the degrees of medicalization. So on that very basis, we can talk about over and under medicalization, and we have tried to understand that in next few slides. Now first we will try to understand the situation of under medicalization. Now the shift to medicalization of illness was leading to more and more aspects of a person's life becoming relevant to their illness, with medicine exploring these wider aspects in order to diagnose and treat illness and also to prevent it. What is stated here is this, that when medicalization happens, then it basically tries to address some of those problems in the human body also, which were earlier not understood properly because of not giving much focus on that by the medical sciences. And so when there are some new types of problem and when the medical attention is given, then those problems also get proper attention, and some kind of treatment or care or cure is also suggested, and that helps in the beginning of the treatment for those ailments or those problems. So this way medicalization helps in recovery from that type of problem, the problem which were earlier not identified as medical problem. Medicalization helps in that. So this is a good situation of medicalization. Now we can talk about a situation in which this is not happening. For example, the lack or absence of medicalization in these required domains where the medical intervention could have helped the person or could have cured the prevailing illnesses. But if this process is not applied, or if there is a disease or an illness which is prevailing, but there is no understanding related to medical sciences on that kind of thing, then certainly this would be a case of under medicalization. In our country, we often get to know about the prevalence of certain types of fever or certain type of disease for which no scientific or medical explanation is often given. And we have seen that in those situations, sometimes huge mortality is also caused. But we are never getting a scientific understanding or explanation of those types of mortalities. So that suggests that those problems have not been properly researched by medical science, and that indicates a situation of under medicalization. So in many of the developing countries and in many of the geographies which are basically backward or somehow marginalized, the problem of under medicalization is often noticed. There are several instances of occurrence and prevalence of unknown fever and other disease, and so medical research is required in these fields as these are under medicalized. Now we can also talk about the engagement of the medical professionals and sometimes the absence of medical professionals, and that absence is substituted by people who are not qualified enough to perform the duty, and for which we make use of the term quacks. So the quacks often substitute the medical professionals and try to claim that they are providing some kind of treatment or some kind of care. So this can also be identified as a situation of under medicalization, because had there been a proper medicalization of the situation, there would have been the availability of the qualified medical professionals. So that way under medicalization is something which is showing us the need of enhancing the pace of medicalization in that particular situation, and that will help in making an improvement in the health condition of the people. And we can identify so many geographies where this concept could be applied. Then we talk about over medicalization. Now we talked about one side of medicalization, that is under medicalization, and there is another side of medicalization which is over medicalization, that is also considered as too much medicalization. Now medicine's absolute control over certain procedures, particularly treatments such as surgery and drugs, permitted the extension of medicine well beyond the diagnosis and treatment of organic disease. So it goes beyond the diagnosis and treatment of organic disease, as with cosmetic surgery or the prescription of many psychotropic medicines. So there are two important situations identified here. One is going beyond the uh, routine medical surgery to the cosmetic surgery, and then another is basically prescribing some kind of medicine for the psychotropic situations. We have already talked about psychiatry. So these are the situations where we can say that that medicalization is going beyond the level of the requirement, or beyond a situation to which it would have been prescribed or suggested, or where it could have served the purpose. So if medicalization is going beyond that, then that situation can be identified as over medicalization, because most of the critiques of the process of medicalization have been talking about the situations which could be identified as the states of, or the situations of, over medicalization. Some of these domains often see situations which could be identified as cases of over medicalization. Excessive increase in cesarean section deliveries, even for non medical reasons, without taking chance for normal delivery, are also situations of over medicalization. Now, in one of the research conducted by us, right, and we have published the findings of that research in a very prestigious journal, Economic and Political Weekly, right. So in that research we found that in a specific area where the study was conducted, there was prevalence of cesarean section delivery much more than the normal deliveries. And when we try to understand the situation at a larger level, then we got to know that in many states of India, the prevalence of cesarean section delivery in the private hospital is much more than the even medically prescribed kind of proportion, as it has been stated by World Health Organization also. So the excessive prevalence of cesarean section delivery is showing a kind of over medicalization. Some of those situations are basically not caused by the medical needs also, as we have found in one of our studies also, right. That means very often the medical processes are utilized or used in those situations where that kind of intervention was not even required. So this is a case of over medicalization. We will see that this is also becoming very common these days. Medicine's absolute access to certain taboo areas, the inner working of our bodies and mind, mean that anything that could be shown to affect either body or mind could be declared an illness. This is basically talking about the way the intimate or inner areas of the body and mind are being increasingly labeled as illness, or situations where medical intervention would be required. For instance, the increase in number of people who are consulting doctors to deal with personal problems like alcoholism and use of drugs, right. Some of these domains may need to be identified as over medicalization, and when we identify those as over medicalization, then a process of demedicalization could be applied there. However, we have already stated that demedicalization gets activated only when certain political or ideological thirst is given. So, uh, we are talking about the scenario in which these situations happen, and there are different types of scenario. Then medicine was increasingly deemed to be relevant to the good practice of life, and so had greater authority to tell people how to live their lives. Basically, in this statement, Scott is basically suggesting that that there are ethical aspects of life also, and sometimes medicine and the process of medicalization is intervening and interfering with the ethical aspects of life also. And this can also be identified as a situation of over medicalization, and maybe in some changed context or scenario, the demedicalization can happen in those situations also. Then we need to talk about one very important process that I think we can talk in this larger context, and that is why I have included in this lecture. This is basically the process of pharmaceuticalization, right? So, what is happening at a larger level these days, that there are certain kind of pharmaceuticals available for n number of situations, may be necessary or may be unnecessary. Very often it happens that the pharmaceuticals or the pharmaceutical company, they define the problem that people are not even aware of, that is a kind of problem. And once the problems are defined in medical terminology, then often those pharmacies are basically suggested or prescribed. There are few research papers that I have taken the content from. So I'll talk about these things, and I have basically referred those research papers also. Much medicalization looks as though it is merely grease for the wheels of pharmaceuticalization. That means most of the medicalization is basically promoted by pharmaceuticalization. This claim is made even more plausible by the fact that some of the standard objects of critics' attention, such as anxiety, depression, and menopause, are closely associated with new classes of drugs. That means there is an overemphasis on these situations, and certain new classes of medicines or drugs are basically provided for addressing those situations. Pharmaceutical companies often engage in selling sickness or disease mongering to increase the sales of certain medicines. And when those problems are increasingly getting identified as sickness type of condition, then certainly the use of those medicine will be considered as appropriate, and this would be identified as pharmaceuticalization. At least some pharmaceuticalization is independent of medicalization. And now, what is also stated here is this, that not always pharmaceuticalization is actually driven by medicalization. In certain circumstances or situations, pharmaceuticalization may operate independent of medicalization. And one example is given here. When people use drugs as remedies for difficulties that they do not necessarily see in medical terms, such as excess weight, sleepiness, lack of focus, and shyness. Now, when the problems are identified, like someone has put up excess weight, that we talk about overweight, right? Then one possible way of addressing that problem could be taking care of the fitness, exercise, and then controlling the diet. But instead of controlling the diet, if certain medicines are prescribed for weight loss, then this is a kind of pharmaceuticalization, because that may not be prescribed by a medical practitioner, but because there are medicines available in the market, those could be provided by the fitness experts also. And that is not only related with this kind of situation, but it could be related to several other kind of things also. Just like that, there are certain things which are used by the beauty enhancing things, right? And several other intervention we can identify. So this is how we can talk about some of the emerging processes of medicalization, and we can say that all these things basically help us to understand the kind of changes which are taking place in the domain of health and medicine. We can conclude this lecture by identifying three important things. The processes of medicalization and demedicalization will continue to operate with different paces depending upon the progress of biomedicine and other systems of medicine. Because biomedicine and other systems of medicine, alternative system of medicine, etc., are also growing independently. So, what kind of course these will take, it will depend upon that. Then, naturopathy, yoga, physical exercise, lifestyle changes, dietary behavior, nutrition, and other psychological and social determinants of health will definitely play a very important role in this discourse, because some of the problems which are caused because of lack of these things, and those are identified as medical conditions, when we have awareness among people, and when people understand the impact of those social determinants, then they can control those situations on their own by bringing change in their lifestyle. So those situations basically may create the need of demedicalization also. And simultaneously, we have also tried to understand the situations where we think that under medicalization is prevailing, and where some kind of medicalization basically is required. So now we can conclude this lecture. We have tried to understand the different aspects, different situations related to medicalization and demedicalization. And in the next two lectures, we will try to understand the contributions made by eminent people like Ivan Illich and Michel Foucault. And in the last one, in this broader theme, we'll try to understand the process of medicalization in the context of gender, because that is again a very important topic. So before we end, have a look on the think about this and activity question, and we will meet in the next lecture. Take care. Bye.